Today's is about global exploitation again, but we will talk more about occupational health and safety measures. Um, so, my first uh, comment on this global exploitation logic is going back to Karl Marx and its alienation to understand both its physical and mental illnesses that the workplace can cause on us. Um, so I want you to watch these two short videos first. So it's a good time to stop this lecture and watch these two very, very short explanations of Karl Marx theory on alienation. Some of you got development of sociological theories or classical theory classes, I know, so you probably know what is Karl Marx alienation theory, but I want you to remember what it is, recall what you had in mind, or if you haven't seen so, I want you to go through it. So please stop right now and watch these short videos.
You can find these videos under the resources on June 19th, week 3, June 19th, or you can just go through the slides and click on the videos. That makes sense as well. And the slides are already uploaded under June 19th as well. Thank you.
I hope you did watch the videos because it is very related what we are going to do today. So the Guardian article and the medical journal article related to those issues of garment industry, clothing work as a matter of global exploitation is going to give you just one example of how occupation or your work or your workplace and environment can affect you, your family, or anyone in this environment in a very, very drastic way. So many workers who toil long hours and attempt to support their families on poverty wages claim they are cheated out of their dues by their employers in those Indian garment work industry. They work for 22 cents an hour for GAP in the Gap, as you know, in Bengaluru in India. One of the garment workers, female worker, explained the situation. Her name is Sakama in the article, in the Guardian article, that it hurts us to be paid so little. I have to do this, and they sell one piece of clothing for more than I get paid in a month. So this is, if you watch the videos carefully, you will get this reference immediately to alienation. What you produce cannot be afforded by you, cannot be part of you in this process, and this is a very, very symptomatic element of exploitation. Another thing the the female worker, shared with us in the article is we cannot eat nutritious food, we don't have a good life, we live in pain for the rest of our lives and die in pain. So I would like to think about the first week, what we talk about social determinants of health, what we talk about medicalization, what we talk about more about the intersectionality, and I would like you to think from all these quotes and from the Guardian article of which social determinants of health are at play here. Just in these two sentences of Sakama, to be honest, you can find out many, many different determinants of health playing a role in this healthcare discrimination and inequality. Another worker who works for Gap supplier Modelema export in Gurgaon gave evidence that he was paid just 5 rupees a month. This is basically 24 cents an hour. Although the legal minimum rate for his job was 5,300 rupees. Rupee is the currency for India. So he also says before a visit, they gather all the workers around and tell them what to say. If you don't say what we are told, we are fired. So you can think of the democratic participation as part of the social determinants of health here. If you don't have a social movement to change the issue, If you can't raise your voice up as a worker, then you can be very much in danger of exploitation and very, very hazardous workplace environments. So I just gave one example, but you can find from these two information that there are other social determinants of health are at play here. I would like you to think about it and write on your comments. As a reference to social movements, there's one social movement that has been recalled in the Guardian article, the Asia Floor Wage Alliance. In the United States, there are a lot of them called there are actually Students Against Sweatshops who are working against this exploitation all around the world at Rutgers. There are also, and this is not only limited to Rutgers, it is going on in many other places. There are like living wage campaigns in New Jersey and all around the nation in the United States, and in many other countries as well. So we can think of other wage and better pay organizations, or equal pay organizations when you think of the male-female gap for the same work in wages. So gap in wages for their work. So Ananya Bhattacharjee, sorry for my pronunciation, international coordinator for the Asia Floor Wage Alliance, told the tribunal that despite the recession, the garment industry continued to bring in profits, so they had to continue having garment industry in India because it brings profits. She said workers continue to suffer shocking inhuman conditions and were being paid poverty wages. Nothing can be more important than a decent living wage for workers working day and night to clothe the world. So if you think about it, although the relationship between the economic growth and poverty, as we were talking in the last lecture, and in the previous ones as well, actually, the economic growth does not bring um, health, like a better health status for people. Sometimes it brings even worse, because for economic growth, which is bringing in profits to the country, um, you can um, you can exclude certain populations from healthcare by privatizing healthcare, or you can basically ignore all the regulations about health and safety measures for occupational health and make them work day and night, treat them as dehumanized beings, calling them donkeys. All it's horrible if you read the article. It's not only the structural violence, as Paul Farmer said before, if you remember the first lectures, um, is uh, uh, is taking place at many different layers. One of them is the dehumanization of these workers. The other one is more like the occupational health and safety measures that they deregulate, the government deregulate to allow the companies to maximize their profits and reduce their costs by giving so little to workers. And even when you think about, it's not only about the wage that they give, it's also the safety and health and safety measures that they didn't provide for those workers. Providing those issues like giving helmets, or like letting them work less hours, are going to be costly for the profit maximizing companies. And when you think of Gap, even probably this is from Gap, that or H&M or Walmart, and all these textile industry that we use in the first world or in other parts of the world, that you can see this is coming from long hours of work, a lot of discrimination in the global south. So just think about it as an ethical consumer to consume those brands. Anyway, I would like to ask you if you know any social movements or organization who fought for a living wage or better pay. um, Fast food workers are very, very much on the news these days in the United States. So you can talk about Fight 15, and they are fighting for $15 an hour, while we were talking about 24 cents an hour in these countries. And I would like you to think about the global hierarchies between those countries as well. Um, If we go to the details of what are the issues, occupational health status of women and men in the garment industry in India, we will come to the study. And first, let's go through the demographics. According to World Health Organization, over 1,000 million people worldwide are employed in small-scale industries. The garment industry of India is one such industry. It is a small-scale one. It is an unorganized sector, mostly run by private establishments. It provides employment for both men and women, mainly those from the lower socioeconomic status classes. Studies show that the musculoskeletal problems, diseases of the respiratory system and eye, accidents, injuries, skin diseases, stress, insomnia, etc., are all common among these workers. The ill health is compounded by various socioeconomic factors such as poverty, lack of education, poor working conditions, excess working hours, and poor diet. You can see all these social determinants of health that the Sakama was talking about, and in other examples that we will see today. Some of you gave a lot of importance to the education, and it pops up here again. I would like you to think about how education affects healthcare and health status of people in general, because we talk about economic growth, poverty, income a lot. Now we have to talk about the working conditions, the excessive hours of working, the environment that they're working, and the poor diet because of lack of income. And I would like you to think about how education plays over these, or if education is as important as the working conditions or excessive hours, so we can talk about it more. Um, so what is the disorder that I couldn't even pronounce? Musculoskeletal disorders. These are work-related upper limb musculoskeletal disorders. So these are different kinds. It comes from here until here, and it can also affect your back a lot and the waist, and even hip. To be honest, I might have a musculoskeletal disorder in a way that we always sit on the same place for hours and hours without stopping to write an article as academics. This is more about sewing and embroidering. You have to do this move all the time, and if you can't do anything else for hours and hours, if they don't let you go, give breaks, then you actually suffer from a lot of muscular diseases. And this gives you a list of them. It can be many of differences, and if you want to check one or two of them what they are, please go for it. Um, so you will understand how our body is actually very material, and the way we use it within the labor force is actually affecting um, how we have a better healthcare or not. Giving breaks are very important, even for yourselves while watching these videos and doing work for the university on the computer. Try to give breaks every 45 minutes. It will radically improve your life expectancy, to be honest, because of all these muscular diseases. Um, the other thing that I would like to go through is the research design they do. I'm hoping that you have already read. I'm just going through them just to make emphasis. They made a community-based cross-sectional study carried out in a slum area of Calcutta in India. And the garment workers were interviewed using a pre-designed, pre-tested, semi-structured questionnaire that had been translated into the local language. The questionnaire collected data on socioeconomic conditions, occupational history, health problems, and they think it is not enough because questionnaire can be misleading. So they did also focus group discussions with 9 workers participating in one discussion about their problems and health issues and complaints about the occupational health. Um, if you have any questions about the study and its research design, please ask me, or please discuss in the comments, because one of the things that you would do if you became a policymaker, or if you will be engaged in any part of the health policies, you have to be evaluating, and you have to be researching on people's health and the reasons that leads to ill health, or the reasons that leads to better health, and you have to design research. I hope you all get introduction to research methods from sociology or any other discipline in social sciences. You will see how they see what's going on among the garment industry workers in India. Um, and they will that's a tedious study they do, and to find out what are really the issues in terms of ill health, what can cause it and what doesn't cause it in many ways. Another thing is like making questionnaire and interviews are important, but making a group discussion, a focus group, also will give you other information about what's going on in group dynamics. Sometimes workers they tell much more among their friends. Sometimes they tell much little. So there are a lot of things going on in those resource designs, especially since their jobs are on the line. When you are very much threatened by these companies, and if you are indispensable, you're actual dispensable worker, like unskilled worker, for the labor market in those countries, then it's very difficult to talk about those things to any researcher or any journalist, or complain about it. You just continue working in whatever situation, whatever health problem it creates for you. So think about all these issues in the research designs that you may be coming up with your own project as well. So, what did I find? Go through the table, and you can see how uh, and which variables are connected to each other, which are statistically significant, which are not. So, the results in words are the average monthly per capita income was 500 to 1,000 rupees. Please check the rupee in terms of dollars. You will see um, how discrepancy is there in terms of currency, and this is part of the reality of the global economy. You can't change it, to be honest. The other result is most of the workers were males, 76%, and were in the 15 to 45 age group, well, with none below 14 years of age. This is probably not true. They just don't register the the child workers, to be honest, in anywhere, not only in India. Um, Also, addiction was rampant. That's more than two-thirds of the workers were addicted to one or more substances, including tobacco, alcohol, or both. Um, 23% of the workers were illiterate. Most of them belonged to poor socioeconomic status. And when we come to the health problem, the musculoskeletal problems, this is the most common health problem. The body areas commonly affected was neck, lower back, and hand, wrist, fingers, and shoulder. The common symptoms in these subjects were pain, weakness, stiffness of the affected parts. Um, of course, these are like extreme stiffness, extreme weakness. So these are the ones that they got from the tables, the statistics, and the age is one of the important dynamics as well. Let's look at age. See, there's the the more they got into these 90, wait, it's if it's more than 45, then you have more. Out of 20, you have 17 of them are having musculoskeletal problems present. So when they do the focus group, they found out other things. One of them is most of the workers were Muslims who had migrated from their rural ancestral homes in Bihar to this urban slum, which is the largest slum in Kolkata. They worked with labor contractors and were paid according to the number of finished goods. There was no fixed remuneration, And when they fell sick, they lost precious hours of work and therefore money. On the other hand, many workers took on extra work so that they could earn more money, even if the heavy workload was detrimental to their health. They also found out the workers complained of low wages, long working hours, no relaxation time, and lack of cooperation of the employer because they were never allowed to go on leave, even when they were sick, and no financial help was given, even if there was an emergency in the family. So they were also very satisfied with the healthcare service, although it is covering everyone in United States, in India, sorry, was available to cater to their health needs. So it wasn't convenient enough for thinking of their working hours and health status. When we go back to the results of the relationship between their work and then musculoskeletal morbidity, I went through the older age, so it is more common in the older ones than the younger ones. Um, and in females as compared to males, in illiterate workers as compared to those who were literate, and in substance abusers as compared to those who had no history of substance abuse. And you can see the percentage here. But these are not statistically significant, so these may or may not be the case. The ones that are statistically significant are those: the working hours, number of years that they work. So the people who worked more than 10 years in the same job, they got much more musculoskeletal disorders than the other ones who worked less than 10 years in the same and a similar job. The ones who worked for longer hours, which is 10 hours, more than 10 hours a day, they have more musculoskeletal disorders. And in those who were engaged in cutting and sewing, which is the like the this job, rather than compared to other jobs in this factories, are affected more by um, more related to musculoskeletal disorders. So all these are statistically significant. So the actual work on your body has much more influence than the age, the gender, the literacy, and the substance abuse when you think of musculoskeletal disorders among garment workers. So, in the discussion section, the authors discuss the work environment exposes many workers to health hazards that may result in injuries, respiratory diseases, cancers, musculoskeletal disorders, reproductive disorders, cardiovascular disorders, mental and neurological illnesses, eye damage and hearing loss, as well as communicable diseases. So, when you think of our workplaces, we actually spend so much time on our workplaces where it is very important. If you do uranium mining, which we will see afterwards, then you will have a issue with your health because it's on your environment all the time. If you work with radiator, nuclear radiator, then you should be careful about the cancer. There are a lot of things. If you work in a mine, coal mine, then you have to be careful about the incidents that happens. They call it accidents, but it's all because the companies, the mining companies, didn't get health and safety measures right, and the state didn't regulate it as much. They didn't send anyone to check the health and safety conditions of mine workers, and all these disasters happen in many places, as we will see. One of them happened very recently in Turkey, in Soma, very close to Izmir, one of the biggest cities of Turkey, and 301 miners died. And it's very common in resource generating places with a lot of raw materials like mines, uranium, coal, or whatever energy the country is producing. And it is not also a third world issue, it is actually a first world issue as well. Similar findings were reported by the Canadian Women's Health Network, with musculoskeletal disorders being the most common hazard in women engaged in sewing. And stress at work is a growing problem for all workers, especially women. According to European Foundation's 1996 European Union-wide survey, women are more likely to have difficulty in taking breaks, days off, or holidays. It is also because of pregnancy issues and etc. The employers were harsh on women. So think about the intersectionality again, as I was referring to, not only about gender class, but also global hierarchies in different countries, living wages in different places, and how it is outsourced to the global south from global north um, in terms of international trade. Um, so now we came to one of those issues that I was referring. There's the please watch the Soma mine massacre in Turkey first. They call it massacre because it's the fault of the companies and the government who didn't take the safety measures for the mine workers until the accident, quote unquote, happened. It is very short. It's kind of mm, it's it's heartbreaking in many ways. All these people in a small town are suffering, and their families are suffering from the same issues. This is a death. This is basically it's about life and death issues. When we look at the Navajo Nation in Arizona in the United States, and they're mining coal mining issues by Vice News video. We'll watch that video as well. So we will talk about how the environment got affected by their workplace, and the workers in that environment are very much the target of those healthcare issues and inequalities. I hope you watched the documentaries, the brief news about these two issues. It is to draw attention to the mining as a very important work and employment for generations and generations in many different places, who has a lot of resources. So, who is the Great Navajo Nation? If you haven't heard before, please check it. The link, I put the link of Wikipedia here, so you can click it. These are their flags and the seals of Navajo Nation. They live around in between Utah and Arizona, and next in Mexico and Colorado. It's over here. They are one of the biggest tribes, the indigenous population that lives here in the United States, even before the migration from Europe happened, and they stay still. So please check their history to understand what's going on in terms of um, race and class dynamics, who are forced to do which kind of employment in United States or in many other countries. To be honest, it's not only United States. So one of the issues that you will see from those videos, that Navajo Nation is not only suffering from coal mining but also uranium mining. They have a lot of resources under their earth, and when they first were employed by the state and then companies to do mining in the uh, around the early 20th century. um, they were first grateful because they were earning money through these employments. But the more they get into, as you see in the documentary very well, the more people started to suffer from lung cancer, respiratory diseases, and issues related to communicable diseases. The 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 federal government deliberately avoided dealing with a health disaster among Navajo uranium miners, even though uranium mining was considered very much of a federal matter, and everyone knew that after the 1930s that there was no scientific doubt that uranium mining was associated with high rates of lung cancer, but they didn't take any measures about this, and they make the Navajo Nation people work for it, no one else. So it became a population, a certain population's issue, a minority issue. For up to 2 decades after the harmful effects of uranium mining were known, protective safeguards were not implemented. Still, you may ask, what are the protective safeguards? Maybe they are not, they do not exist. But if they do not exist, then they have to think about um, which kind of measures, which kind of like limitations to this labors, and which kind of salaries that do they receive, because they actually put their healthcare into danger. should be discussed, and these are not discussed at all in general. But mostly, and for first and foremost, we should discuss the safeguards, the protective measures that people could benefit. It can be costly, but people's lives are worth paying money for safeguards by the companies who make so much money out of those mining. This is the end of the class. It is these are all heavy issues. So in while watching documentaries, I had to stop a couple of times to think about what people go through. And I don't want you only sympathize or empathize with those people. I want you to think of structural violence, structural elements, which are affecting certain populations in different places in the world, and think about all these intersections between those gender, class, race, sexuality issues, and how occupational health matters for people. Um, there are there are different layers of inequality here, um, and when you see certain populations are targeted for certain jobs because they live in such and such place, and their lives are seen more disposable by the elites or by the hegemonic ruling class, then you see how uh, it is such an unfair world. But I would like you to think about also there are a lot of people like the grandmother in the Navajo Nation that still fights against all these inequalities. That gives you hopefully some hope. Hopefully some hope. And I hope you will discuss and find out other social movements which will better people's health status all around the world, so we can discuss about these and be more hopeful about certain situations related to healthcare inequalities. Thank you so much for listening.
There's one more thing that I forgot to mention. Sorry, yeah, I have to add this. Last year, when I was teaching this course, one of the organizations in New Brunswick joined us, called the New Labor, and they are working with mostly temporary Latina workers in the region. And New Jersey is a very industrial place, so there are a lot of people who are working in subcontracted companies temporarily for certain high-risk jobs mostly. So if you want to check, you can find them on Facebook, or you can find their website. It's New Labor, the organization's name. And it's very close to George Street, actually, where they are located. They made a lot of also alliance with Rutgers scholars. One of the readings that I assigned for today is also one of their reports with Rutgers about gender and work, and how higher or lower payment the different genders got. If you want to have a look at it, it's very useful reading, and it will give you, especially if you're interested in policy making and become a policymaker later on about these issues, including occupational health. That's a very good read, and they explain how they do it, and etc. One thing that's actually very important also about occupational health is the government regulations on occupational health, meaning if your workplace and healthy and safe. This goes back to the discussions of what work means, what labor means, and in the 1960s, especially in the United States, there were a lot of permanent jobs. The contracts were between 3 to 5 years. As we say in universities now, we had tenure-track professors, meaning, or we have tenured professors. Tenure means lifelong. You can actually think of all these varieties of jobs as tenured before. It doesn't exist anymore. Even United Nations work with very short-term contracts. And this makes the labor very flexible. By flexible, we mean, although it sounds very positive, the name flexible, it might have a lot of consequences in terms of health and safety. So by flexible, we mean the hours are not, the contract is really flexible. So the hours are not set, the benefits are not set, the employee and employer can make deals all the time, and it's not as like a factory kind of mass production kind of worker logic anymore. There are a lot of white collar workers or service workers or a lot of other workers that that might be needed for a while and that might not be needed afterwards. So rather than permanent jobs, they started to create a lot of temporary works and a lot of temporary work agencies, as you will see in the trailer of the documentary. If you find the documentary, please watch it, A Day's Work. It's done by Dylan Eve Labor. And they basically work through a person's life who was killed at his first day in the workplace because of lack of health and safety measures. And you will see some blurbs from the very very short trailer that will give you the structural violence, structural problems in temporary work and temporary workers' health conditions. Subcontracting is part of it. Subcontracting means a big company needs a lot of workers that they don't want to hire, so they find another company who will subcontract for them all the jobs. It's very, very common in construction business. It's also very common in call centers and many other jobs that you can hire a company to find workers for you. It's like a hiring worker, hiring agency, but a different. They also run the human workforce. So and they arrange it mostly short-time contracts. The health and the health benefits are much less in these temporary work jobs because it's rated by hourly mostly. And there are higher risks of getting hurt at workplace because most of these temporary jobs are created for short-term and for dangerous jobs that people don't want to do regularly. Some of them, not all of them, to be honest. And there are less trainings or less control over health and safety measures by the state agencies if it is temporary work. Think about it. If it is like I work for 2 days in one construction company and then I will leave, who is gonna control my health and safety in those 2 days that I work? I might come back next month for the same job, but I might not as well, and I might actually getting killed in the way just because some of the health and safety measures were not correct in the workplace. And state agencies has to regulate it. One thing you should know about the state agency that does the occupational health, deals with the occupational health issues, that they are extremely overstaffed and they are cut more and more with every government. So their regulations, although in paper, in law, it has to be the case. Sometimes it's not the case because they can't send all the people there. The workers sometimes take their own cautions and warn their own employer to make them sure to provide all the health and safety measures. So that's one thing. And it is also connected to the Karl Marx videos because part of the capitalist logic is about labor and exploitation of labor in terms of short-time exploitation, making it much less beneficiary for the workers in terms of health benefits and insurance. So there are two problems here. One of them is health and safety conditions at the workplaces, but the other part is also less health benefits, meaning like either no health insurance or worse health insurance than you can if you're actually permanently hired. The this is the documentary that I want you to have a look of the trailer. The documentary I think you can find through Amazon, but I'm not sure. But the trailer will give you an idea, and I don't want to take more of your time, so let's watch it together.
My name is Antonia Washington. Everyone calls me Nia. My oldest brother was Lawrence Daquan Davis. Everyone called him Day. He was killed at his very first job on the very first day as a temporary worker.
His first day at work was his last. The accident happened here at the Bacardi plant on Jacksonville's north side.
For many, it's come down to finding any work to get by. As a result, more people are turning to local temp agencies.
Businesses have been hiring more temporary workers than any other kind.
Many people think about temporary work simply is not a reality.
I remember when a temp worker was a temp worker. That's dramatically changed. Now, sometimes as much as 90% of workforces are temp workers.
The term temp work has nothing to do with the length of these work assignments. It speaks to the nature of the employment relationship.
Every industry gets safer every year, and it's going in the complete opposite direction for temp workers.
It's easy to quantify the number of workers being killed because that's reported. What doesn't always get reported is who they worked for.
It's the best kept secret in the temp industry.
Daheg studied to be a medical assistant.
He was the father figure. He was always there.
Temporary blue-collar workers in Florida were 6 times more likely to be injured. And you can see right here, he goes underneath the machine.
He didn't know what was going on, and you can tell because he looked confused just running across the thing.
They have to hit the ground running. It's not a training situation.
OSHA found nearly a dozen violations, and these
violations, 13 of them labeled as serious.
But even then, now we have this evidence of what they do. What do we do now?
One person is still unaccounted for after yesterday's massive explosion.
A 41-year-old man fell into a working meat blender.
Overcome by some sort of chemical.
The company relied on temporary workers who started here a few weeks ago.
By an industrial mixer working on a temporary basis.
You don't work here no more. You don't work here no more. You don't work here no more. So please go away. You don't work here no more. You don't work here no more.
Government talked about that. That is something that we can influence in the United States at every state level.
The temp industry has remained a very strong political lobby. They've become deeply entrenched in our way of doing business. Outsourcing the issue of safety to some outside agency clearly makes no sense.
It doesn't add up. The story doesn't add up, period, to me.
So, other than these really horrible facts in the world, hopefully we will continue learning more about the movements, health movements, and also we will discuss how this class, race, and gender come together. And you can see this was about occupational health. Mostly this week was about global exploitation of occupational health. There's gender elements, there's race elements, there are country of origin elements, because health regulations or even labor regulations in the northern hemisphere is much more pro-labor, pro-worker than in the global south. And the global south wants to get developed, as we discussed in the discussions of globalization before. So that's why they don't want to regulate the labor law. They can be okay with, Bangladesh can be okay with their citizens to work for 16 hours a day, because it's boost economy. And there are a lot of relations of colonization from history. When you look at these patterns, who owns the companies and who are the workers and how much the workers work, and what are regulated and what are not regulated. So always keep in mind. There's another issue that popped up this week, you heard in the news, the Grenfell Tower in London. This is not occupational hazard, this is an environmental neighborhood issue. Just because these people were poor and the environment, the neighborhood was extremely rich, they couldn't gentrify those people out. So they just couldn't pay attention to them. Basically, the fire alarms didn't work. It's not occupational haphazard, but it's a living condition haphazard, and it has to be taken care also by the building managers, the company who built this construction, which didn't pay €2 more, 2 more pounds for the for making the building safe from fire. They could have saved all those people that were killed by a horrible fire. So where you live, how your life and building is safe or secure, or have your community established like Navajo Nation in a certain neighborhood that the industry corrupted and infant mortality gets higher and higher, and you keep seeing more and more kids not being born normally and having a lot of deformations during the birth. These are avoidable. Again, we go to the discussion of avoidable and avoidable inequalities. Somebody has to pay attention. That somebody responsible, mostly we address because of the law we address the state to take care, but also there are a lot of companies who are responsible of their workers in this case, because as you saw in temporary work, the employee, the real employee who is, I don't know, one of the big firms or something, you don't even know who you work for sometimes in the temporary work conditions, and they are not liable. That's the problem of temporary work and subcontraction. The subcontractor company, the company in between, the hiring agency or the staffing agency, as they call it in the United States, is the one that's responsible. But they make the contracts or the daily job so not pro worker that at the end you can't find anyone liable legally, and that's a big issue in this case in the documentary A Day's Work, and in this in general here in your work. But if you don't find a job in general, you're very vulnerable, and especially in the United States, that the mentality, the consciousness is at the level that I have to work, I have to work, I have to work. Nobody will take care of me if I don't work, or which is partially true everywhere in the world. And the unemployment benefits are only there if in certain conditions, not always. And in people's eyes, being poor sometimes means like you are lazy or you are not working hard or something, although sometimes that's not the case at all. It's just matter of luck or structural inequalities in terms of like where you were born, what you do, which race, gender you belong to, and etc. That it gets really complicated. So thinking all these complex issues, when you think of the causes of how we become sick, or how we lost our health, or how we couldn't prevent our health to be worsen. It's not only about access to healthcare in terms of health insurance, which is extremely important, but also it is also the social determinants of health. What is behind those inequalities? Race, gender, class, poverty, neighborhood, which kind of industry you live around, environment, all of those, country of origin, all of those are in it, and global exploitation can give you a very complex idea of which part of the world is more prone to certain diseases and illnesses while others don't. But also it's getting more like a global phenomenon, because even within the advanced nations like United States or United Kingdom, as you see with the Grenfell Tower incident, that even in the middle of London, which is one of the wealthiest city on earth, that you can have a huge fire because of carelessness, of the government or of the building managers or of the construction company, like all of them you can blame at the same time actually. It's like Flint, Michigan issue. I sent you one document, hopefully you read. They already got accused of manslaughter because of not taking precautions. So for water crisis in Flint, Michigan. So they killed someone at the end. One person died. Nobody can say it's God's fortune or it's destiny or something. There was actual negligence, which is more than negligence because it ends up killing someone. So all these things I want you to think of very in a very complex intersectional way. That's why we read intersectionality from the first week, so we can think about all the different layers of these issues. I want to end here, and thank you so much for listening, and sorry to prolong the video afterwards. So thank you.